The next step was to make a scanner that could detect the signals resulting from radioactive FDG within the body and turn them into an image. Biomathematicians and computer scientists created complex mathematical formulas and computer programs to convert the signals resulting from radioactive tracers into a three-dimensional image. The far-flung nature of this work can be seen by the fact that some of the mathematics that underlie it were borrowed from those developed by astronomers to image galaxies and other distant celestial bodies, as well as those created by electron microscopists to three-dimensionally reconstruct some of the smallest particles in the cell. The ultimate end product of this disparate research was PET, which was later combined with other types of medical imaging, CT for example, to provide both anatomic and metabolic information. Throughout the 1970s, researchers used FDG in PET scanning not to detect tumors, but rather to image brain cells in action. For the first time, this tracer non-invasively revealed the previously hidden workings of the mind. What parts of the brain are active when individuals carry out various tasks, such as speaking, hearing, remembering, and the perception of painful events. PET also opened up a whole new physical window into the previously hidden human psyche, tying abnormally low or high activity in specific brain regions to various mental disorders, such as severe depression, substance abuse, and schizophrenia. Inspired by FDG's success in imaging brain activity in PET scans, several researchers started exploring other clinical applications. Aware of the increased use of sugar by tumors that Warburg had shown decades ago in 1980, researchers in the Brookhaven group showed that a variety of tumors in animals had greater uptake of FDG than normal tissues. A few years later, radiologist Giovanni DiCiro, who founded and headed the National Institutes of Health Neuroimaging branch, showed that brain tumors could be seen as heightened FDG uptake hotspots on the PET scans of patients. CT scans and MRIs reveal physical structures within the body that have been changed by cancer or its treatment. But some changes in structure, which include the development of scar tissue, may not indicate an actively growing tumor. In contrast, PET detects metabolic activity rather than tissue damage. Thus, actively growing tumors can be easily distinguished from scar tissue and will light up in PET images. DiCiro showed that PET scans could distinguish between the radiation scars of treated tumors and those of tumor recurrences, unlike CT scans and MRIs. As one radiologist pointed out, MRIs and CT scans detect the reaction to an abnormality, such as a tumor, but PET scans reveal the actual abnormality. Within a few years, the early PET findings exploded into a number of clinical applications, with physicians using PET to image several different tumor types in their patients. The use of PET in oncology became especially common by the early 1990s after researchers showed that whole-body images could reveal metastatic tumors that had spread throughout the body from the primary cancer site, often months before they could be detected on CT scans or MRIs. Another development that dramatically expanded the use of PET scans was the debut of combination PET/CT scanning device called the Medical Science Invention of the Year by Time magazine in 2000. The PET/CT scanner enabled physicians to pinpoint more precisely the location of tumors, especially in relation to other organs and tissues. When a person is first diagnosed with cancer, his or her physician uses various imaging techniques to determine how far the cancer has spread, which determines the severity of the disease and the optimal treatment. By detecting metastases to which other imaging modalities are blind, PET can enable more accurate staging of cancers, thus indicating whether surgical removal of the organ initially affected is warranted. PET is particularly useful in detecting cancer that has spread to the lymph nodes. Cancer cells tend to travel first to these pea-sized organs of the immune system, which are scattered throughout the body before reaching other organs and tissues. Those cancers found to be affecting lymph nodes are often treated more aggressively than those limited to the original organ in which they appeared. Lymph nodes are considered cancerous on a CT or MRI scan if they are greater than about a centimeter in size. But tumors in the lymph nodes can be seen as bright spots on a PET scan before lymph nodes grow to that size. By more accurately showing the extent of tumors, PET/CT scans can also improve radiation therapy and surgical removal of cancers. Surgery's success in treating many types of cancer depends on its complete removal of the initial tumor. But it can be difficult to locate the edges of a tumor. Researchers are currently testing handheld PET scanners that can image, during surgery, the hot spots of breast cancers and other tumors that avidly take up FDG. By making these tumors glow during surgery, their margins are likely to be more visually obvious to the surgeon. PET can also reveal sooner than a CT or MRI whether tumors are responding to treatment, in some cases just a day after treatment is given, because responding tumors often become less active before they shrink in size. The lessened activity can be detected by PET scans, but not by conventional imaging, which just detects tumor shrinkage. Typically, conventional imaging does not reveal an unresponsive tumor until several months following treatment, time that might have been better used receiving an alternative therapy. Researchers continue to develop new ways of using PET. One recent development has been the combination of PET and MRI into a single apparatus. Compared to CT, MRI generally provides more detailed images, which can aid in the more precise localization of cancer growths. This also has the advantage of reducing the radiation exposure for patients during imaging procedures. Similarly, researchers continue to develop innovative cancer tracers that can be used in PET. Instead of detecting heightened sugar uptake, these tracers detect other traits common to tumors, such as leaky blood vessels, excessive growth factor receptors, or heightened cell division that, along with or instead of FDG, might better image tumors and even suggest which treatments are more likely to work. Experimentally, PET is also extending its reach into other medical specialties besides oncology. PET imaging is starting to help detect atherosclerosis and inflammation in blood vessels that are some of the first steps along the road to a heart attack. Researchers have also begun to explore the potential of this imaging to detect the onset of arthritis before there has been much damage to the joints, allowing early treatment. Most recently, PET probes that detect amyloid, one of the features of Alzheimer's disease neurodegeneration, have shown that accumulation occurs long before much memory loss. The hope is to make PET probes that accurately detect abnormal molecular activity early in the progression of these diseases, prior to the occurrence of tissue damage, and then to develop treatments that prevent disease progression before the body is significantly harmed. Basic research has revealed key molecular players that underlie the development of these disorders and has provided researchers with a palette of potential PET probes for detecting the early signs of disease before symptoms appear. Practical implications of PET scans continue to unfold and could not have been predicted by the initial pursuits of researchers who were pursuing answers to basic questions about a wide variety of topics, from the smallest components of the atom to distant celestial objects. This cadre of curious and determined researchers from a diverse range of disciplines contributed to the development of PET imaging as a way to detect diseases during their earliest stages, when they are most likely to be amenable to treatment. By so effectively spying on disease, PET has helped to pave the way for a revolution in the practice of medicine.